This is a little bit out there compared to other things we've been doing, so open your mind and practice, because very emotional arousal can make it impossible to use most other skills. So tip skills are rapid ways to reduce emotional arousal. The skills are temperature, the use of cold water on the face to elicit the dive response, intense exercise, pace breathings, and paired muscle relaxation. There are 2 P skills, even though we only have 1 P in the TIP abbreviation. Each skill has the effect of rapidly changing your biological response patterns and thereby causing a reduction in your emotional arousal. TIP skills change your body chemistry to reduce high emotional arousal and feelings of being overwhelmed. TIP skills work very fast, within seconds to just a few minutes, to bring down emotional arousal. TIP skills are as effective as dysfunctional behaviors at reducing painful emotions, but without the short and long-term negative results. Examples of dysfunctional behavior might include drinking alcohol or using drugs, overeating or restricting food, or self-harm. TIP skills work like fast-acting medications, but without the cost of medication or the side effects. TIP skills are easy to use and don't require a lot of thinking. Pace breathing and some parts of paired muscle relaxation can be used in public without others knowing that you're using any kind of skill. TIP skills are useful when you are caught in emotion mind and can't get out. You are in crisis and have a high urge to engage in destructive behavior and you cannot distract yourself. An important demand needs to be met and you are too overwhelmed to think of what to do. You're not processing information effectively. You are emotionally overwhelmed. When other skills are not feasible to do or not helpful, even if you are not in crisis, and when you are at your skills breakdown point. The TIP skills are designed to activate the human body's physiological nervous system for decreasing arousal. The nervous system consists of 2 parts, a sympathetic nervous system and a parasympathetic nervous system. These 2 systems work in opposite directions. The sympathetic nervous system activates the fight or flight response and increases arousal. The parasympathetic nervous system increases emotional regulation, which is associated with decreasing emotional arousal. All of the TIP skills regulate emotions by increasing activity in the parasympathetic nervous system and decreasing activity in the sympathetic nervous system. Physiological arousal is an important component of emotions, and changing any part of the emotional system affects the entire system. The first skill is tipping the temperature. We do this by putting cold water or cold packs of ice on the face while holding your breath. This induces the human dive reflex, which sets off the parasympathetic nervous system and reduces physiological and emotional arousal very quickly. The dive reflex is a tendency in humans and other mammals for the heart to slow down below resting heart rate when you are immersed in very cold water without oxygen. This effect is due to increased activation of the parasympathetic nervous system, which is the body's physiological system for decreasing arousal. States of emotional over-arousal occur when the sympathetic nervous system becomes overactive and the parasympathetic nervous system becomes underactive. The dive reflex can be induced the following 3 ways. Use a bowl of cold water, bend over it, hold your breath, and dip your face up to your temples for between 30 to 60 seconds, or until you start to become very uncomfortable. This is usually sufficient to induce the dive reflex. The colder the water and the longer the immersion, the better. However, do not have the water too cold because water below 50 degrees Fahrenheit may cause facial pain during immersion. You can also use an ice pack or a Ziploc bag of ice with water or a cold, wet compress and sit in a chair and hold whatever you've chosen around your eyes and upper cheeks. You want to wet the side touching your face. Standing, bending over, and holding your breath at the same time appears to increase the effect of this inducing the dive reflex. You can also induce the dive reflex by splashing cold water over your face. Splashing cold water on your eyes and cheeks may be totally sufficient. To make it work even better, stand, bend over, and hold your breath. Cold water and cold packs are also helpful when you cannot sleep due to ruminating or background anxiety, or in instances where you're experiencing disassociation, including disassociation during therapy or skills training sessions. Have a little safety break with this one. It's very important to be cautious if you have any sort of heart condition, as using cold water to induce the dive reflex can reduce heart rate very rapidly. If you have any heart disorder or a heart rate below the normal baseline due to medications or other medical problems such as anorexia nervosa or bulimia nervosa, please ask permission from your doctor to use this procedure. Understand that the physical effects of the cold water are very short-lived. It is easy for the out-of-control emotion to return if you're not careful. Once extreme arousal is reduced, practice emotion regulation skills appropriate for the problem at hand. You could be problem solving or coping ahead, remember? If you use cold water or a cold pack to interrupt anxiety or rumination that is keeping you awake, go back to bed and focus on something other than anxiety-inducing thoughts, such as paced breathing or thoughts of pleasant events. The second tip skill is to engage in intense aerobic exercise of any kind for at least 20 minutes. The endorphin release of intense exercise has a rapid effect in decreasing negative mood and ruminating thoughts and increasing positive effects afterwards. State anxiety decreases significantly if you get your heart rate to 70% of the maximum for your age. Increases in positive emotions are also associated with getting your heart rate between 55 to 70% for the maximum heart rate for your age. But the increases are maintained for a significantly longer time when you get your heart rate to 70% intensity. Look up calculating heart rate training zones on your device. There will be charts showing maximum recommended heart rate for each age. Emotions organize the body for action. Anger organizes the body to attack or defend. Fear organizes the body to run, and so on. When the body is highly aroused, it can be difficult to inhibit emotional actions, even if the action is dysfunctional. Intense exercise in these situations can downregulate the body to a less emotional state. Just as emotions prepare you for action, the actions themselves are important components of emotions. Inhibiting emotion-linked actions can, therefore, be difficult. Use exercise when you are agitated, when you are angry, when ruminating just will not stop, when you need to bring up your mood and willingness in the morning, and in situations you have found exercise useful for you in the past. You were tired at the end of your workday and get a call from your boss asking you to come in early tomorrow for a meeting. You feel utterly overwhelmed by this request and start ruminating about how you will never get enough sleep and you will never get a break from your boss. You grab your sneakers and you go out for a run to decrease the strong negative emotions. After your run, you return and have a relaxing evening, getting yourself into bed early. The third tip skill is paced breathing. This refers to slowing the pace of inhaling and exhaling to an average of 5 to 6 breath cycles per minute and breathing deeply from the abdomen. Breathing out should be slower than breathing in. The heart beats faster during in-breaths and slows down during out-breaths. This change in heart rate is influenced by sympathetic nervous system activation. Upon breathing in, and parasympathetic nervous system activation when you breathe out. Paced breathing causes a change in sympathetic and parasympathetic activity in a way similar to the dive reflex. Slowing breathing to approximately 5 or 6 breaths per minute to one complete breath cycle lasting 10 to 12 seconds is effective at reducing emotional arousal by activating the parasympathetic nervous system. It's best to use a stopwatch or a clock for this one, maybe on your iPhone or Apple Watch or a clock on the wall. Count seconds to practice paced breathing. Place the clock facing you, and I want you to watch the clock. So you count the seconds you inhale and the seconds you exhale. You want to find a comfortable, slow breathing rate. Try 5 seconds in, 1, 2, 3, 4, 5, and 7 seconds out. 1, 2, 3, 4, 5, 6, 7. You can count, then pause at the top, inhaling for 5 seconds, and then at the bottom, exhaling for 5 seconds as well. The fourth tip skill is paired muscle relaxation, which is the pairing of relaxing muscles with exhaling. Paired muscle relaxation is a variation on progressive muscle relaxation, which is used widely across behavioral therapies for anxiety disorders. The strategy is to tense muscle groups, noticing the sensation of tension while breathing in, and then relax them by letting go of the tension while you exhale. Notice the sensations as the muscle tension gradually goes down. The goal is to increase awareness about tension and relaxation. As a crisis survival skill, paired muscle relaxation teaches you to notice tension and then relax muscles, and to pair relaxation with exhaling while saying the word relax in your head. Sensing and then relaxing muscle groups causes your muscles to become more relaxed than they were in the beginning, and more relaxed than they can ordinarily achieve by trying to relax without first tensing. Paired letting go of tension with the word relax in your mind while exhaling conditions your body to let go of tension and relax in the future when you say relax in your mind while exhaling. Let's try this. Make fists with both hands and pull them up on your wrists. Hold them there and inhale for 1, 2, 3, 4, 5. Now release them, breathing out for 5, 4, 3, 2, 1. Now make fists and bend both arms up to your shoulders and breathe in for 1, 2, 3, 4, 5, and then relax and breathe out for 5, 4, 3, 2, 1. Remember, you exhale and think the word relax in your mind. Pull both shoulders up to your ears and hold for 1, 2, 3, 4, 5, and relax. Breathe out for 5, 4, relax, 2, 1. Pull your eyebrows close together, wrinkling your forehead, and breathe in for 1, 2, 3, 4, 5, and then breathe out and relax for 5, 4, 3, 2, 1. Shut your eyes tightly and breathe in for 1, 2, 3, 4, 5, and relax for 5, 4, 3, 2, 1. Now bring the sides of your mouth up to your cheeks for 1, 2, 3, 4, 5, and out for 5, 4, relax, 2, and 1. Now push your head back onto the chair, onto the floor, onto your bed, and pull your chin down to your chest and breathe in for 1, 2, 3, 4, 5, and out for 5, 4, 3, 2, 1. Now take a deep breath in and hold it for 1, 2, 3, 4, 5, and exhale, relax your chest for 5, 4, 3, 2, 1. Now arch your back and squeeze your shoulder blades together for 1, 2, 3, 4, 5, and relax for 5, 4, 3, 2, 1. Let's try squeezing your butt and holding for 1, 2, 3, 4, 5, and then relax. 4, 3, 2, 1. Now stretch your legs out straight and point your feet like a ballerina and breathe in for 1, 2, 3, 4, 5, and then relax for 5, 4, 3, 2, 1. Now, relax completely. You are all done, and I want to just make one last note. You may experience a phenomenon of reaction-induced panic because of not meeting the expectation to relax. Realize that awareness of your body tension is the purpose of this exercise, not relaxing. You can stop at any time during the exercise and simply just listen. The combination of effective rethinking and paired relaxation is a method of using both cognitive restructuring and progressive muscle relaxation to bring down arousal rapidly in moments of high stress. Don't knock it till you try it. That's it for tip skills. I absolutely love these skills and I find them extremely helpful. The cold water / ice packs gets, a little bit to get used to, but if you need to bring down your nervous system, it is an excellent way to do that. You want to keep ice packs in your freezer to have them available, and intense exercise is wonderful, but please understand that if you are in an angry or stressed or even anxious state, it is not a time to punish yourself with intense exercise. Intense exercise in this skill is to relieve stress and to increase endorphins. So please be mindful if any desire to self-harm comes up with this skill. Then you can use your stop skill to prevent that from happening. I think it's a great idea to use both paced breathing and paired muscle relaxation as proactive ways to center yourself too. So I encourage you to do that.